My comments are going to be brief. I don't have any prepared statement. I just wanted to reflect on some of the things that came up over during the last day's session. First, I'm sharing with you an analysis that was done in New York City originally, looking at mass fatality incidents. I think you may find this useful as your committee moves forward with this project. We identified meeting the criteria, and the criteria for our study. And I want to mention that we actually expanded this study working with Harris County, and this, I'll explain how that could even be more useful for you. But this particular study identified 168 incidents that met the criteria for a mass fatality incident in the United States. This is in the 50 states and the District of Columbia, resulting in 12,205 deaths. This is from the year 2000 to present. It includes 9/11 and Hurricane Katrina, which makes up for approximately half of those 12,000 deaths. Now, what I think you may find interesting about this, we learned a lot of lessons, and this talk wasn't put together for this committee. I wanted to share this with you because I think you may find this information useful to this project. This study really looked at lessons learned from the medical examiner's perspective, did not look at it from other perspectives. And you'll see the top 10 lessons learned on the bottom there. What I think we may find useful, and you may want to, and this is a recommendation that I would give to the committee, you may want to look at these incidents. We took data from medical examiner and coroner offices, their final tallies, and look at it today. And I heard yesterday someone discuss the possibility that you continue to identify cases years out from an incident that may be indirect or contributed to as a result of the incident. So you may want to look at those numbers and see if those numbers have changed. Now, I'll give you one example. About 15 years ago, 16 years ago, we came to a final number for 9/11, 2,757 fatalities. These are people reported missing. There may be more, but that's what we have as the official number. That number hasn't changed. And yet you know that there are many people who have died as a result of exposure, et cetera. But that number has not changed. So hearing what I heard here today, that number would be potentially in the tens of thousands today if we were to apply the process that you're suggesting. And I'm not saying that that's not anything that we would object to, but it's not something that is currently done in New York City. So I want to talk about two processes that medical examiners and coroners deal with, particularly from the standpoint of New York City, and really I think we'll answer some of the questions that came up yesterday. You know, I want to start by, and I did address this specifically, I heard someone say during the meeting that the reason that the medical examiner or coroner does not count these indirect deaths or deaths that are contributed to is to keep the numbers down. It's political. Let me assure you that it's nothing of the sort. There is nothing political about my office. In fact, most medical examiner offices in this country are independent. They're independent of the mayors and other leaders of those organizations, and they're done so intentionally to keep those offices apolitical. And I can assure you that in New York City, nothing of the such would ever occur. It is not about keeping the numbers low. In Hurricane Sandy, we had 45 deaths reported by my office. There were likely many more indirect deaths and other deaths contributed to, but they are not included in that final count. And I'll explain a couple of the reasons why. First of all, with respect to natural deaths, we have no jurisdiction. It's a legal issue. Medical examiners and coroners, for the most part, have very clearly defined legal requirements for what cases they take. We do not take natural deaths unless we are acting on behalf of that individual who would not have a physician. At least that's the rule in New York City. It may be different in other jurisdictions. So every jurisdiction may be different. But for the most part, we're not addressing natural deaths. And many of these deaths that occur afterwards that may be contributed to. And the best example that I can give you is the way New York City, the medical examiner's office, deals with heat waves. Right? We have a heat wave. Clearly, if you look at the number of deaths that occur during a heat wave, there's a significant bump. And yet, you will see in our office, we don't report heat-related deaths. We report heat deaths, heat fatalities. What do I mean by that? The case definition for a heat fatality in New York City at our medical examiner's office is that there must be objective clinical findings, either an elevated body temperature that's determined at the time of death or some point after, or there's histologic findings. period, end of discussion. So the 85-year-old, with or without significant comorbidities, who climbs 3 flights of stairs during a 100-degree heat wave and has a heart attack is not counted unless he has an elevated body temp or histologic changes on autopsy. So with that kind of strict criteria for a heat fatality, it makes sense now for those of you who are asking questions as to why we wouldn't include what would, clearly be, to everyone, and even in for the most part in the lay press, it's believed, they report out these heat-related fatalities all the time, and yet we don't declare them as heat fatalities in New York City. So I think that brings somewhat of an understanding to this very strict case definition within the legal context that I'm describing. The 2 recommendations that I have that I really thought about over the last 2 days for the committee is, one, that you really should think about engaging the medical examiner and coroner community specifically, either through the National Association of Medical Examiners or through the International Association of Coroners and Medical Examiners, because coroners and medical examiners operate somewhat differently, although coroners typically operating more as medical legal death investigators overseeing a substantial number of offices in the United States, as well as forensic pathologists who have varying thoughts. I could tell you that the training under my former boss, Dr. Charles Hirsch, who's trained, I think, a little over 100 chief medical examiners throughout the United States, they adhere to this very strict case criteria, case definition criteria. So when we talk about a death that occurs during an incident, that individual has to be involved in the incident at the time of the incident and has to be directly related in order to be included. That case definition is very strict. And we don't really, vary from that. I mean, it doesn't happen. In fact, there's much discussion often about, bringing in this subjective, and it is subjective, right? When we talk about determining whether or not this is a, hurricane-related death or a heat-related fatality, it is really the story or the subjective findings that would need to be brought in order to include this case. So my other recommendation is, in addition to engaging with the forensic pathology organization, the National Association of Medical Examiners and the International Association of Coroners and Medical Examiners, I think you can gain some better insight as to what role, because I don't think it's out of the question to persuade them to think about this indirect, because it is significant. There is a good argument for indirect deaths, but it is not something in many offices that is currently entertained. The other thought on this was, how could we approach this in order to get this data? And I thought about the way we do it in New York City with respect to communicable diseases. Communicable diseases, unless we determine, for example, in the case of meningitis, that there's a potential public health threat, and we take those cases, we will, anytime there is a potential public health threat, we will take jurisdiction, legal jurisdiction in those cases. They're not medical examiner cases. So AIDS cases, TB cases, et cetera, they're reportable deaths. So one suggestion that I have to you is to make contributory, or what is believed to be contributory or indirect deaths, reportable. This way, all of those natural deaths, ultimately, that will never come to the medical examiner's office, will get reported just like a TB case would get reported. It would be mandatory reportable deaths related to an incident. Just a thought. So I'll reserve the rest of my time for dialogue. I'm sure there'll be a number of questions. Thank you.